Hi, today we are going to be doing a cranial nerve exam on you. Is there anything you would like to tell me before we get started? Okay, so we're just checking it out, making sure everything's okay. I'm just going to start putting on my gloves and then we get right into it. So you've had nothing concerning happening lately, right? Okay. All right, so it's like kind of a yearly checkup for you. Nothing really wrong, just making sure everything's okay. All right. Okay, I got my gloves on and I'm just gonna start by getting your temperature. I have two temperature guns. This one's gonna go in your ear and the other one's just gonna go on your forehead. So just stay still. It's gonna go inside your ear and you'll hear a beep. Okay, good. Okay, good temperature here. Let me check the other ear. Okay. Good temperature on both ears, but we always want to double check. So I have this other temperature gun that's just going to go right on your forehead and the sides of your cheeks. Okay, stay still. Good. Good. Perfect. And right here, the temperature is good as well. Not concerned about anything there. All right, so I just want to check out your eyes. So I'm just gonna look with this light. Is the light too bright for you? Okay. All right, can you follow the light? Very good. Let me know when the light leaves your peripheral vision. So I need you to look at my nose and keep your head straight. Don't move with the light. Just let me know when it leaves your vision. Good. Good. Okay, now let me know when it enters your vision. Good. Okay, done with that light. I'm just going to quickly take a look at your pupils, making sure that they're both like an even size, that there's nothing wrong with them. So I'm just going to this. Okay, I'm just gonna get kind of close. All right, try to keep your eyes open. Okay, can you look up for me? Can you look right? You look down. And can you look left? Very good. You can blink, blink, blink. Okay. Let's do the other eye. Okay. Same thing. Try not to blink and look up for me. Okay. Good. Look down. Look left. And look right. Very good. Nothing concerning there. I'm going to cover your eye. And I want you to look at my hand. You can see my fingers, correct? Great. I want you to tell me how many fingers I'm holding up, okay? All right. Let's begin. Good. Let's do the other eye. So right here. Okay. Ready? Okay. Good. Fantastic. Can you tell me what color this is? Good. What color is this? And what color is this? Perfect. Okay. I'm gonna cover your eye again. So I have this here, and I want you to read the smallest letters you can see. Okay? Very good. Now we're going to switch sides. I want you to tell me the smallest letters you can see. Okay. Very, very good. All right. So I'm just going to take this light. Okay. So I want you to look at the white light. Now look at the red. Look at the white light. Now the red. Okay. I want you to look at this light and tell me when the red light turns on like that, okay? So just keep looking at the light. Don't look over here, okay? Let's begin. So I want you to count how many times, okay? Good. That was 6 times. Let's do this side. So just look at the light. Don't look over here, okay? Let's begin. Perfect. That was 8. Okay. Now I'm going to tell you some instructions. All right. So I want you to start by looking at my nose. Okay. Now look at the white light. Good. Now look at the red light. Look at my nose. Look at the white light. Don't get distracted, okay? Keep looking at the white light. Look at the red light. Look at my nose. Keep looking at my nose. Okay. Look at the red light. Now the white light. Okay. Keep looking at the white light. Okay. Very good. Okay. All right, now look at my nose. Tell me when you see my hands move like this. Okay, they're going to be in your peripheral vision. Just look at my nose. Good. All right, we are all done with your eyes. So now we're going to be looking at your ears. I'm going to start off by looking inside your ear with an otoscope. So just let me replace the top of this tool so that we can make it an otoscope. Okay. The top just fell off. Okay. Let's put the top on it. Perfect. Okay, I'm going to be looking inside your ears with this otoscope. All you need to do is stay still, and if you feel any pain, which you wouldn't, just let me know, okay? All right, just stay still. I'm going to look at this ear first. Great. Now I'm going to be looking at the other side. Stay still. Very good. Looks pretty good. I didn't see any redness, any bumps, anything stuck in there. I didn't see any wax buildup. So your ears look great. I'm going to be observing the outer of your ear. So I have my leg. I'm just going to rub up against your ears, okay? All right. You can feel me touching your ears, right? No pain either? Okay. Good. Let me try the other ear. So you're not feeling any pain here either, and you can feel me touching your ear, right? Great. Very good. Now I'm going to test your hearing. I have this tuning fork, and all you have to do is tell me when the sound stops, okay? All right, let's begin. Very good. Very good. Very good. Very good. Okay. I am going to do another test. Let me know when you hear this sound. So count how many times you hear it, okay? Okay. How many times? Perfect. Now we're doing the other ear. So let's cross that one out. Let's begin now. How many times? Perfect. So we're actually going to do a more in-depth hearing test now. I'm going to put these headphones over your ears, and you're going to go through different beep tests, and you're going to tell me whatever the answers are. There's going to be different types of questions, so I'll let you know during each set, okay? So I'm just going to put these on. All right, how do they so for the first test, you're going to let me know when you hear the sound, okay? So for this one, it's going to be what ear you hear the sound, okay? So tell me left or right. You did fantastic. Your hearing is really, really good. So now I'm going to test your face. I have this little hammer here. I'm just going to press it against your face. I want you to tell me when you feel the hammer on your face, okay? All right, let's begin. Alright, same thing kind of. So I have a different hammer and I have a fan, and we're going to do if it's soft or hard. Okay, so this fan is going to brush it up against your face like that, and the hammer is going to hit your face like that. So I want you to tell me what you're feeling. Okay, so this one I need you to close your eyes. Alright, let's begin. What was that? Okay, that was the fan. And that, the hammer. Okay. Good. Okay, perfect. Very good. Okay, I'm just going to touch along your face. I'm looking for anything that is painful, any bumps or bumps. Okay. Very good. Your face looks awesome. Okay, now I'm going to do a taste and smell test. So I have this here. You're not gonna like roses. Roses. You can see that. Roses. Very good. Okay. Here, let's see. We have another one here. Okay. Now let's spray that. Okay. What's it smell like? It smells like caramel. Very good. Next one I have is here. Okay, let's take a smell. Okay, so this was a trick question because we already had this smell, but this one's also roses. So there's rose petals in here. Very good. Now we're gonna do a taste test, okay? Open this. Okay. I'm gonna just put this on your tongue, open wide. Good. What does that taste like? Very good. Strawberries. Okay, let's do the next one. Okay, open wide. Oh, what does that taste like? Banana. Very good. One more. And what did that taste like? Coffee. Very good. You did fantastic. So lastly, we're going to do kind of like a coordination test. So I need you to close your eyes, okay? I want you to take your finger and touch your nose. Okay, very good. Now I want you to touch your forehead. Good. Now I want you to open your eyes, reach out and try to touch my finger. Very good. Now I want you to just look at my nose and I'm gonna go super close. Okay, just follow my finger. Good. Okay, everything looks really, really good. I'm not concerned about any of your cranial nerves, so I'm just going to write that down. Yeah, the appointment went super well. I'm not concerned about anything. Your hearing was perfect, your eyesight, smell, taste, coordination, everything was awesome. Also, it doesn't look like you have the flu or the fever from the temperature. Okay. Okay. And that is it for our appointment today. Thank you so much for letting me examine you. You did fantastic. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye.